Hey, Dr. Rob Silverman here, Amazon best-selling author of Inside Out Health, a revolutionary approach to your body. So many docs, I get to lecture every weekend, so many docs and so many patients ask me this one question: where am I in my recovery phase? Where am I in my injury phase? And that's the patients. And the doctors say, well, what's the frequency of treatment? When do I add this product? When do I add active care? When do I add passive care? Can I combine the two? What about adjustment, soft tissue, laser, which nutritional supplement, etc.? So I wanted to go over that with everybody today. I'm asked that so often and everything like that. So I just wanted to break them down into the 3 phases of care. There's a multitude of phases. There's a multitude of sub-phases. So let's start with the first phase of care. So if everybody's watching this, do me a favor, share it, like it, ask a question, even give me a shout out where you are. Say hello. But definitely share this information with patients, consumers, and doctors alike. The first phase is and everybody's going to love my handwriting. Steffi, I'm sure, is laughing. I can't see her. The acute phase. That acute phase is the first 72 hours. So that's within the first 72 hours. So one of the things that I tell everybody in the first 72 hours is please avoid heat as much as you can. Heat can be very deleterious. Heat increases inflammation. We want some inflammation in the first 72 hours. That's probably one of the only times where we want a little more elevated inflammation, because inflammation enables people to heal. So let's call it an acute phase in the first 72 hours. Patients, you wait so long to come to the doctor. Many patients say to me, well, I wanted to see if it would go away. I wanted to see how it would heal. Here is a key takeaway point for you. Musculoskeletal injuries typically do heal, not properly on their own. So with that being said, you need some form of exercise, some form of medical, chiropractic treatment, coaching, if you will, to let you know where you are in the phases and what's the best thing to add within the phases. So be real careful. Certainly reach out to a practitioner, a chiropractor, of course, functional nutritionist, personalized lifestyle practitioner. They are critical to talk about what's going on in the acute phase. So within that acute phase, number one, it's a manage and modulation of inflammations. Things are hot, you're going to feel that they're red. Inflammation means to set a fire. So some of the things that I would recommend at that point is that is the one time in that 72-hour period that when it comes to exercise, underlying exercise, that you can use what we call passive care, meaning that we can move it. Me as a practitioner can move, and you can do passive care where you're laying there and you can add certain modalities. With that being said, I'm a big proponent of laser initially. So I use a lot, everybody knows the Aconia lasers. Aconia lasers have several FDA clearances. Essentially, I use them to modulate inflammation and to help healing at a cell level. Cell is a critical element. We all know we're put together by cells, and cell proliferation and cell healing is a critical element to overall healing. With the acute phase, let's remember that you have tendons, cartilage, ligaments, bones, etc. So with the acute phase, some of the things that I'd recommend are, one, we can do passive treatment, a little passive, get them moving. You've nothing wrong with getting passive into active right away. I have no problem as long as the structures are attached. I'm going to go like this and that, and I'm going to switch and do a little red guy here and do a little active. Active is great also at the beginning. We're going to switch active into the subacute and then, of course, into chronic and wellness, etc. So with that being said, what would I recommend for passive? I would recommend low-level laser therapy. I would recommend mobilization, manipulation if at all possible, soft tissue, active release, instrument assisted like Factor, instrument assisted with movement, taping. I don't even have a problem if you use ice. Supplements. What supplements am I going to recommend in the acute phase? So the supplements that I would recommend in the acute phase are your typical proteolytic enzymes, trypsin, chymotrypsin, and bromelain. They're fabulous because they decrease swelling and they take cellular debris out of the area of injury. With that being said, critical element to take those proteolytic enzymes is to take them in between meals. When you take them in between meals, they function as a proteolytic enzyme. If you take them at the time of a meal, they work more as a digestive enzymes. Fish oils. Love my fish oils. What I love about the fish oils, best fish oils that I use right now are the Biotics fish oils, like my Biotics Bio Omega 1000, because they are triglyceride form. They're shown to be 14 to 16 times faster into the body than all other forms, so I'm always a proponent of triglyceride form over the ethyl ester form. That's the highest level of triglyceride forms. Found that to be extremely effective. Turmeric also is a great choice at the time of acute injury, because turmeric biomodulates down specific inflammatory pathways. Remember, we don't want people to take pain opiates. We don't want people to take NSAIDs. Pain opiates, we all know, are extremely hazardous to everybody's health. Study came out last year that said that 2 lumbar spinal adjustments over a 90-day period decreased your incidence, only 2, decreased your incidence of using pain opiates by 55%. As everybody knows, I'm a big proponent of no NSAIDs, no non-steroid anti-inflammatories, no Aleve, no Advil, no ibuprofen. NSAIDs decrease pain but impair healing. Nutraceuticals, like I'm trying to delineate right now, help with healing. NSAIDs also cause leaky gut. To speak to the gut, I'm a big proponent, no matter what you do, you want to modulate inflammation. So by modulating inflammation, you always want to keep somebody's gut healthy. So at that point, I have no problem with anybody using specific nutrients to help gut health and gut lining. GI Resolve and other type of products like that are excellent, and those are all going to be based on, again, turmeric, glutamine, okra, MSM, and different herbs that have a very calming, healing effect in the gut area. So with that being said, I think the treatment or the frequency of treatment should be almost every day. There should be some home exercises, and some of the home exercises are obviously taking your supplements, doing whatever mobilization, and any icing that everybody says. Now, I like icing initially, but I also like icing with some movement. So you're really in here getting into passive, into the active treatments. Did we have anybody? I think you were trying to get them.
Just a shout out from Kristen Tennis.
Hey, Kristen Tennyson, how are you? I know that you're there now. Thanks so very much. I will not call you to let you know. I'm doing it right now. Are we good? Excellent. So now let's go into what we call the subacute, or what I like to refer to as the repair, remodeling, everybody loves that handwriting, I know, phase. So subacute, that usually starts on day 4, and that goes up into including week 8. Now you could break it into 2A and 2B with repair and remodeling. So obviously the repair phase is the area starting to repair. Inflammation has come in. You don't want inflammation to go too high, so pro-resolving mediators are a great choice to enable the resolution of inflammation. Once again, SPMs or pro-resolving mediators are a critical element. I love them because of their resolution of inflammation. I love them in combination with a great omega-3. They work really well. Other things that you're looking are different hops and different glucosamines and chondroitins to really help knit the particular area in your soft tissue areas. In addition, at this point, with the laser, I now like to integrate what I call the EVRL, the violet and red laser that Arcona uses, because it has both a violet and a red light. At this point, I use the violet light to help with breaking the fascia, any fascial adhesions, help the fascia heal, and the red light helps with the musculoskeletal components in the peripheral nervous system. Active care. Let's get active. Let's get them moving. Exercise rehab. Proprioception, critical element. Now at this point, I may be using, in my opinion, the instrument assisted in the active phase, and I may rub a little harder, maybe bring a little blood to the area, because I may want to increase inflammation shocking. At this point, I'm only rubbing in my opinion, to rub the fascia area, and because the fascia has Golgi tendon, the fascia is an interconnected cell that is connected to the skin, so it's connected to all other areas of the body. That being connected to all areas of the body, it's communicating, so I want to get its stimuli. So the subacute is a lot more movement. The subacute is that active care, exercise rehab. Of course, your adjustments come in there. One of the best adjusters I know, big shout out to a good friend of mine. We'll be working together next week at the Florida Chiropractic Association. Dr. Mitch Malley. Mitch, big thumbs up. Mitch does a great job. So if you ever want to see it and see a great adjuster, look at Dr. Malley. He's going to be coming up on a webcast. In addition, Dr. Malley and I are going to be at 8 Weeks to Wellness on May 17th. So big shout out going out over there. Subacute, day 4 through week 8. So repair and remodeling. You're looking for fibroblastic proliferation in this particular phase to allow for collagen being set in a parallel form. You see a scar tissue get set down and you feel it in the patients when they come in weeks and weeks after an injury. What you're seeing is fibroblastic proliferation to collagen being in a perpendicular form. You want collagen in a parallel form so it knits and the skin and the soft tissue is healed in a much more appropriate manner. Last but not least, because we got a few others, I'm going to go red. Not that red is bad. The red's not working right now. So let's go back to black. We're going to go to a prevention wellness phase. So what are we going to do in the prevention and the wellness phase? So number one, of course, we're going to get chiropractic assessment. We're going to assess their movement. For me, movement is a critical element. So we're going to see how they move. They may not be in pain. We want to make sure they're moving well. We want to make sure that we've engrammed what's going on. We're going to work a lot with the brain in phase 2, subacute, and always working with proprioception and brain input in the wellness and prevention phase. In addition to that, we're going to be adjusting any joint, any area that needs to be adjusted. Big thumbs up to all that. Take a look at the soft tissue, and we want them on a specific diet, a non-inflammatory diet, maybe a ketogenic diet, a Mediterranean diet, and such. Also now, we're going to have an exercise program. We want everybody to exercise and perform the exercise well. To avoid injury and to keep yourself healthy, let me give you a few things. Number one, reset your lifestyle. Make sure you're eating well. Adhere to my GPS. My GPS, no gluten, no processed food, no sugar, no dairy, no nicotine, no artificial sweeteners. That's my DNA. In addition to that, if you want to reset your body, big reset may be doing a intermittent fast, or what I like to refer to, which is shown to be in the literature outstanding, a fast mimicking diet. If anybody wants information, reach out to me on that. I think that's a great choice. And take 5 supplements, 5 easy supplements, a multivitamin, multi-mineral, phytomulti. Number 2, take an omega-3 fatty acids. Take vitamin D, D3 with K2, a great choice. A good quality probiotic. And always take a green or a dynamic green drink to help prevent injury and keep your wellness. Go to your chiropractor regularly. You know, one of the things that was really funny, had a patient come in and they were like, well, how often do I have to come in? So I gave them the plan, and I'm always an under-promiser, an over-deliverer. I'd like to do that. I don't like to make big, robust promises because I don't want to look like I failed. So I asked a particular patient, and they said that they had been to a dentist 100 times in their life. Okay, not bad. 45-year-old, about twice a year. Once or twice they had to go a little bit more. I asked them how many times they went to the chiropractor, and they said they've been to the chiropractor 3 times in their life. Now, I know the teeth, how important the teeth are. I know how important dental hygiene is. It's very aesthetic, of course, but also real heavy with the bacteria, in that the bacteria is a critical element to overall heart health, neurodegeneration. So this is important. It's this big and important. This big and important. So if anything, you should at least go to the chiropractor at least as much as if you've gone to the dentist. That particular individual was 97% beneath what they would. And you may want more because you got more going on. You may just want to come in for the wrist or the elbow. So without question, see a chiropractor, see your functional practitioner. I love to call everybody a functional nutritionist, personal lifestyle practitioner. You know, the word functional medicine is out there. I think it's great. I just like to refine it a little bit. So with that being said, do you have any questions or any shout outs I need to address?
Just Yes, one more shout out from Kimberly Hayden.
Hey Kim, how are you? Yes, we're going to be in Minnesota in April, I think it is. No, I think it's May. I think we're going to be in Minnesota in May, the first week. So I got it right. And that's it. So anybody have any questions on the phases of care, please feel free to reach out. Every Tuesday, we do a Facebook Live in the area of 2 o'clock. Let me know what you think. Let me know if there's something you want to see next Tuesday. Hope to see you all soon. Dr. Rob, always yours in health.